The volume of blood being pumped out by the heart in 1 minute, specifically the left ventricle, is called the cardiac output. A normal cardiac output is 5 liters per minute. So to calculate the cardiac output, let's take a closer look at the left ventricle. To imagine what's happening here, let's picture the left ventricle as a cup. The blood that enters the left ventricle comes from the left atrium, and the blood that leaves the left ventricle goes to the aorta. Essentially, the heart works in two phases, diastole and systole. Diastole being filling and systole being squeezing. At the point where the left ventricle has completed its filling with blood, there's a point where it's fully relaxed. At this end diastolic point, the volume of blood in the left ventricle is called the end diastolic volume, which is usually about 120 milliliters. Then, the left ventricle contracts and squeezes that blood out to the aorta to the body's various tissues and organs. This is called systole. When the heart is fully contracted and no more blood is pumped out, there remains a volume of blood that's left in the left ventricle. This volume of blood is called the end systolic volume, which is usually about 50 milliliters. Knowing these two values allows us to calculate the stroke volume, which is the volume of blood that gets pumped out of the left ventricle with each heartbeat. So the stroke volume is equal to end diastolic volume minus your end systolic volume. So with the numbers that we used, 120 milliliters being our end diastolic volume, and 50 milliliters being our end systolic volume, equals 70 milliliters. But one thing to keep in mind is that the stroke volume is relative, which means the calculated stroke volume can be good or bad, depending on the size of the patient. 45 milliliters can be okay for someone with a smaller heart, like a child, but can be low for someone with a bigger heart, like an adult. Because of this, we can calculate the ejection fraction, which is the stroke volume divided by the end diastolic volume. Remember, the end diastolic volume is a volume of blood that's left in the left ventricle after it's filled. So if a patient that has a stroke volume of 70 milliliters and their end diastolic volume is 120 milliliters, then your ejection fraction would be about 58%. Normal values for ejection fraction is about 50 to 65%. So now that we have our stroke volume, we can calculate the cardiac output. Remember, the cardiac output is the volume of blood being pumped out by the heart in 1 minute. Your stroke volume times your heart rate. If the stroke volume is 70 milliliters per beat and your heart rate is 70 beats per minute, cardiac output becomes 4,900 milliliters per minute, essentially 5 liters per minute. A normal adult contains about 5 liters of blood, which means all the blood in the body passes through the left ventricle each minute. Kind of cool. Another way to calculate the cardiac output is through Fick's principle. Here, the cardiac output is equal to the oxygen consumption divided by the arteriovenous oxygen difference. Using a spirometer with a closed rebreathing circuit incorporating carbon dioxide absorber, you're able to calculate the VO2 max. And by taking the oxygen concentration of blood from the arterial system, which represents the pulmonary vein oxygen concentration, and by taking the blood from the mixed venous system on its way back to the heart, you can calculate the arteriovenous difference. So, in a given example, if the oxygen consumption is 250 milliliters per minute, and you calculate the oxygen percentage from the arterial system to be 19%, and the oxygen percentage of the mixed venous system to be 14%, then the amount of oxygen lost per milliliter of blood is about 0.05, which is 5%. So, 250 milliliters per minute divided by 0.05 is equal to 5,000 milliliters per minute, or 5 liters per minute. It's important to remember that during exercise, cardiac output is maintained by increase in heart rate and increase in stroke volume, and that during the late stages of exercise, cardiac output is maintained by increases in heart rate only because the stroke volume plateaus. Also, it's important to remember that diastole is shortened by increase in heart rate, which makes sense because if the heart is beating more times per minute, that means the left ventricle has less time to fill, thus shortening diastole, or filling. Less filling time means a decrease in cardiac output, which is usually seen in ventricular tachycardia. Hope this was helpful. Feel free to reach out or subscribe to my channel. I usually don't make my tutorial videos on YouTube, but if you guys want more and have any more questions for me, feel free to reach out. Alright guys, good luck.